Welcome to part two, how to renovate your data submission program. I'm your presenter, Dawn Carter, and today we're going to talk more about strengthening provider relationships with these best practices. And just as a reminder, this is part two of a four-part series focused on the best tools to have in your risk adjustment renovation toolbox. And in part one, we talked about the first three tools, and now we are going to focus on the next three tools, which include sandpaper, a level, meaning a data level, and primer, meaning a data primer. And these tools are specific ones that help you to build stronger provider partnerships, being that the source of all the data we use for risk adjustment are the providers. So let's begin. So as I promised on my earlier installation, part one, I want to turn the focus to the providers as part of the integrated and high quality process, since they are the ultimate source of that data that gets submitted to CMS for the purposes of risk adjustment. As any do-it-yourself handy person knows, before you prime and paint, you need to get out the sandpaper. The abrasive quality of the sandpaper is what eventually produces the desired outcome of smoothness, and that certainly applies to the tool we use to address provider relations. Assessing your organization's tolerance for provider abrasion is an important starting point of provider partnerships. Let's face it, asking providers to perform any additional tasks can certainly cause abrasion. However, to ignore the provider's role in this process in the interest of preventing abrasion can cost precious revenue. This sounds easier than it actually is, and providers care most about caring for their patients, and rightfully so. However, it is possible to show them how the quality of the data they send to the health plan eventually affects the cost and quality of the care they give to the patients, regardless of whether or not they are capitated. When performing your root cause analysis of data that does not pass CMS edits, when you look at the body of data with errors that are attributable to what the provider is sending, not what data fails due to your own system limitations or incorrect data extractions, use the following checklist to guide how you address these issues with your providers. First, educate. Perform provider education so that they can do their own impact analyses and systems adjustments. Your provider relations department and the person in charge of claims needs to perform this education. Second, assist. Better yet, offer to help those departments do this education and the follow-up, which is just as important, to ensure that the incidence of the errors are decreasing. Third, incentivize. Consider incentives for those providers to implement your recommendations, especially if they have to make system adjustments that will incur a cost. Some health plans adopt a less proactive penalizing approach, but this rarely works and frequently worsens the abrasion. And last but not least, dollar demo. Equipped with the risk score impact in dollars and cents, talk to providers about what happens if they don't comply. Money talks and people listen. You'll need the help of your risk analytics team to do this, but this exercise will go further than any other to get the point across. Providers are smart and will see that large amounts of lost revenue will ultimately affect the quality of care that members receive. Now let us turn our attention to our data level. Using a level to ensure that items are hung correctly is an essential part of a toolbox. It is equally important to balance out your data so that it is presented well. Compare RAPS and encounter data submissions to understand the completeness of encounter data, and then take it a step further to understand the financial impact of gaps. Recall that the EDPS dataset is much broader than that of RAPS and includes services that were not historically sent for RAPS. Therefore, at the very least, you first need to ensure that for every RAPS submission, there is a corresponding EDPS submission. If there isn't, you'll need to do some investigation. I'll explore that further in my final best practices article in this series. There are other risk adjustment analytics that are dependent upon the accurate transmission of both EDPS and RAPS, so this comparison is critical to identify submission gaps that affect risk scores. And third, let's talk about a data primer. Before you get out that paintbrush and put the finishing touches on that data by submitting it to CMS, You want to take the time to prime your data. Of course, attention to data completeness and quality gaps, as we've been discussing, is an important priming activity. But there are other special situations in encounter data processing that require special priming. This is especially critical for supplemental chart review data, so we will focus on that here. This step is a bit harder because it will require the expertise of people in your organization who oversee chart retrieval and review operations. But the most important thing to consider is that any priming activities include the following. First, proper formatting. Chart review submissions have some special formatting requirements for the X12837 that clearly identify the submission as a chart review, as opposed to a regular encounter. It is important to understand how to use these. Otherwise, the encounter type switch for submissions on your MAO4 are likely to be inaccurate, and it could be very hard to determine the ROI of your retrospective and prospective projects. Second, validation. If you are using external vendors for chart review and other retrospective projects, you need to ensure that these files are validated before sending them to CMS. They are validated against the same encounter rules as all other submissions. Provide these vendors feedback on their data quality, establish action plans for the root causes of data quality issues, and recognize that they too need a seat at the table when establishing integrated and high quality processes as discussed earlier. And this data validation aspect actually goes back to the providers as well and their individual coding practices. And third, matching. Do not overuse the unlinked chart review option simply because you lack the resources or for some other reason won't build the appropriate processes to attempt to find a match to a previously accepted encounter. CMS will eventually set a metric for this and does question submitters who are submitting only unlinked data. Also, don't be caught dumping. CMS has established a metric for the volume of encounters that can be submitted in the 2 months prior to the submissions deadline. Traditionally, for RAP submissions, there has been no limits as to what is submitted for sweeps, but EDPS does have restrictions and CMS will sanction those plans that do not comply. Ensure that you are submitting according to CMS requirements for your health plan enrollment, and this includes data that results from your retrospective and prospective campaigns. And again, some of these issues could have their genesis in the provider data because they have to be sending claims in a timely manner in order for them to be processed as encounters to be linked to. So as a brief recap for our number 2 article, here are the tools we discussed today. Though you won't likely find any of these at Lowe's or Home Depot, there are vendors out there such as Centauri who can help equip you with the right tools for your specific renovation project. Be sure you tune into our next webinar in this series, which will feature additional tools to help with error reduction strategies and to help educate stakeholders on these and other strategies.